Good evening, Wildcat families. We are so excited to have you here with us this evening for Cat Chat Live. We are very excited to have a special guest with us today from University Health Service, Fadia Lowe. She's going to be talking to us about all the different resources that are available to your student here on campus, so that when they're sick, you'll know where to send them, and you'll know how to prepare them for that. So without further ado, I'm going to hand it over to Fadia Lowe.
Thank you, Nikki. I appreciate the time tonight to share with you guys a little bit about University Health Service. First, my role is the Health Education and Wellness Manager at the University Health Service. So I help oversee our health education and wellness programming, which is kind of our way to provide outreach for students to learn a little bit more about University Health Service, but also to keep them healthy so they don't need to come into our clinic all the time. So we are located at 830 South Longstone Street, and this is our building. We have services on the first floor. We have services on the second floor and the fourth floor. So the best way you can give your students directions is to tell them that it is located right across from the Shell and the Speedway gas station. Next slide. So our main services that we provide, primary care clinic. This is just your general clinic where your students might not feel well. Obviously, we're still in a pandemic, so we're seeing a lot of upper respiratory infections. We do have COVID testing in our clinic, so we definitely are utilizing that a lot. With masking, we're seeing a little bit less of what we normally see during a regular season. We haven't seen near as much flu, that we do contribute a lot of that to the masking, but we are still testing for COVID. So we have a great service that's been added to our clinic just for this pandemic that we're in. The other services that we provide are gynecology and GU care clinic, full service clinic for students. We also in our GU clinic offer Transform Health Clinic. All of our appointments are available via telehealth as well. We introduced telehealth during the beginning of the pandemic, and it's been a great success. A lot of our students enjoy the telehealth option, so we have that available in most of our appointments that don't need a physical exam. Our nursing clinic is awesome as well. We have full service allergy clinic, so if your student does take allergy shots, needs to be seen, we can have them set up a recurring appointment for that. And then a service that a lot of students are not familiar with is behavioral health clinic. We have board certified psychiatrists that offer medication management, ADHD testing, and help students with depression and anxiety. We work very closely with the counseling center. So this is I think, underrated, great service that students need to learn more about. And oftentimes they just don't know until they've been at the university a couple of years that they have that service. And then the area I mentioned, health education and wellness, that's the area that I specifically oversee, which I can talk more about in a little bit. Next slide. So who can use UHS? So as a full-time student, students have access to University Health Service. So they've already paid that health fee of $175, which includes services that the counseling center uses as well. That fee is not, you can't waive out of it. You paid for it. So we really want to encourage students to utilize that fee instead of making an appointment and going home. This keeps your student on campus, and it's very easy to access. So if we also have the ability now to file private insurance, which we did not have before, but since we've transitioned to Epic, we are now able to do third-party billing if there's something that is not covered by the health fee. And then if students fall below 12 hours and they don't have the health fee, they can add it back in if they'd like. And then during the summer, all students have to purchase the health fee separately, so it's not automatically included in the tuition. And that's $175 to be able to use the University Health Service for the entire summer, which is a pretty good deal. And then we have an additional option for students who might not have excellent coverage in terms of insurance. So some students come out from out of state and find that their plan's not great in terms of covering it within our network. So they could opt for the student health plan, which is a better plan in terms of covering them in Lexington area, and it complements the health fee. So that's another option that parents or students can purchase to supplement if the insurance that they currently have is not adequate coverage. Next slide. So we are open Monday through Friday, 8 to 6 p.m. during the semester in regular hours. During Saturday, we have a walk-in clinic, 9 to 11. And that actually, it's not a walk-in clinic anymore. I need to remember that. It is actually required to have an appointment. It used to be a walk-in clinic, but we've switched everything out because of COVID. So all students must have an appointment when they come into our clinic. Saturday clinic appointments are typically for a follow-up. So say the student came in late on a Friday and the provider wants to follow up. So also in the summertime, we don't even offer the Saturday clinic. It's just Monday through Friday, 8 to 4:30. Now, if something happens and your student wakes up in the middle of the night and they're not sure what to do, we really want to encourage them to call the on-call physician. We don't want to send students to the ER unless it's absolutely necessary. Definitely don't send your students to the ER for a COVID test. We had a lot of that in the last few months, and that really bogs down the ER, and it's not a good use of their time. So call the on-call physician. Typically what happens is somebody will answer that call. They will triage your student, they will check on them, they will follow up with them. If it seems to be something that they can come in for the next day, or say it's just like 7 o'clock and then urgent treatment center is open and the student is very concerned, an urgent treatment option is obviously available to them. Next slide. So what does the health fee cover? This is just a nice list for you and your students to kind of be familiar with in terms of unlimited office visits. So, we immediately have the students come in under the health fee. If that we're not going to charge their insurance unless they, don't have the health fee, and they can still come in, and then it would be kind of a copay option. But, unlimited office visits for injury and illness, allergy injections, well patients if they're traveling, if they need it for an employee physical exam. I mentioned our gynecology services. We also offer, STI testing and counseling. We have an observation room in the event that the student is really ill and just needs to be observed. We see a lot of students utilize that service during cold and flu season. Our phone information nurse, I'll talk a little bit more about that service. I mentioned the on-call physician. We do have a full service pharmacy, which is on the first floor of our building. And it's kind of a little secret to tell students, like, don't go to Walmart, CVS, come to the University Health Service Pharmacy. They're going to get everything that they would buy at Walmart and Walgreens a lot cheaper in our pharmacy in our building. We also offer limited medications in the event that, like, say they need some pain reliever or something for their throat if they have a cough. We have those available at a discount at the pharmacy. We also offer discounted birth control. We also offer free nicotine replacement therapy in the pharmacy as well. I mentioned our behavioral health office visits, and then the health education services specifically that we cover. We have a registered dietitian who focuses specifically on eating disorders. Question.
Hi, sorry, I didn't mean to interrupt, but I wanted to see if you could talk a little bit about where all of the pharmacies are that are available to students. Where would they go?
Okay, great, awesome. Yes, so there are multiple pharmacies, but the one in our building is the one that we really want to send students to specifically, because that is in our building on the first floor. That's the pharmacy that's going to give the discounted medications to students. There are other pharmacies like in the Kentucky Clinic where we sometimes send students there and it's a larger pharmacy, but those are the two main pharmacies that we usually send students to. There is a pharmacy that's in the hospital that's kind of tucked away that also has medications, say that the Kentucky Clinic wouldn't have, or like UHS wouldn't have. But we really want to send the students to the pharmacy that's on the first floor, which is 830 South Limestone Street. It's on the first floor of our building. Does that answer that question? Okay, great. So the health education and wellness coaching, I'll talk about that in another slide. Excellent service. And then, yeah, go ahead. Next slide. Thanks, Nikki. Okay, so what's not covered under the health fee, which, we're learning and transitioning as we utilize Epic and bill private insurance. So some of these things obviously not covered under the health fee, but that's where the insurance is very handy to have and that we can bill. So your student needs an x-ray or a lab, we're going to send them to Kentucky Clinic, most likely. So that is where your insurance is going to be handy. As long as they have it in their My Chart, it should not be an issue. Obviously, we don't do hospitalization, but if they need to be hospitalized, we're right there next to the hospital. And then I mentioned after hours care, that's obviously not covered. Anything that requires a surgical procedure, referrals to specialists. We do have a referral coordinator, which a lot of students don't know about, but she's an excellent resource if a student needs a PT referral, MRI, CT, all those things. She can actually sit them down with their insurance and help them get the appointment that they need anywhere in Lexington. So wonderful service. And then prescriptions, obviously, we don't cover prescriptions, but if you have your insurance, the pharmacy on the first floor utilizes private insurance, so it works just like any other pharmacy. And then vaccines, we have any vaccine that you need available, and then we would have to bill your insurance for the coverage on that, but the actual visit would be included in the health fee. Next slide. So I mentioned the phone information nurse, but just a little bit more about her. She's super, super popular, a wealth of knowledge. She answers the phone from 8 to 4:30, and she just is fantastic. She will typically help students figure out, like, do you need to come in, or are you somebody that can wait a couple days if it's just like, cold, or if there's something they can try at home before they come in. She'll also help schedule appointments if they need to have appointments scheduled for like a follow-up. And she can call patients to inform them about lab results. But again, as we're in Epic, you can get your lab results through the My Chart. So that's another piece where if it's urgent and the student doesn't have My Chart, she's going to call. If we don't get a follow-up from the student because they haven't checked their My Chart, she's going to call for those lab results. Next slide.
Claudia, real quick, can I ask a question? We have a question
Yes, ma'am.
from a parent.
Yes, ma'am.
Question about making an appointment for an asthma check or medication for asthma maintenance. Can they do that at UHS?
Absolutely. They can just call if they don't have a My Chart. I would recommend calling first, mainly because you want to make sure, if you've not been to UHS, that the student gets put in with the right provider. Online scheduling is available, but for something like that, they might be able to make sure that they get a provider that specializes in that area. So that's definitely I would call for that appointment.
And then we have another question from a parent. How would her student give her permission to be the emergency contact for UHS?
So when they fill out their information in their My Chart, it does ask then it asks in the My Chart for the emergency contact person to be listed. And sometimes if they miss that part when they are signing up for My Chart, when they come in and they're checking in after being registered, the registration front line should be asking for that any missing information. So that could be a time to tell them for the emergency contact to make sure it's listed in there. Awesome. So this slide is just an overview of, again, the health education and wellness services. We're really wanting to promote our wellness services. We work along campus with Well Kentucky, which is also a great network of wellness colleagues who come together to try to serve the university and the needs of the students. So we're all focused on well-being. This is a resource that's very important right now because, again, we need to keep our students not healthy in their mental capacity and physical capacity as well. But we just know the two go hand in hand with keeping them academically successful. So some of the things I've already mentioned that we offer, but one thing I want to highlight is that we also have student peer health educators who go out and educate students on how to be sexually safe, how to make good decisions, how to utilize your resources on campus. So if we don't have that service available through University Health Service, we are going to connect the student to a service on campus. So that is a very great role for students. And then we have a Student Health Advisory Council in which we recruit students to give UHS feedback, to tell us what they think is important and what they would like to see included in their health fee, and how to make our healthcare better. So it's very patient-centered, and it's driven by students, and the mission is to help improve healthcare policy. So that's another avenue for students to get involved in. Next slide. So specifically want to mention our health and wellness coaching. So we know that there's other coaching services on campus, but our health and wellness coaching is a little bit more specific in areas that we typically see come up when students come in for behavioral health appointments, or when they come in because they might be experiencing GI issues. Our providers can refer students to us to help with their, just to help them set some goals. Maybe they're not sleeping enough. Maybe that's why their stomach hurts. Or maybe they have poor time management skills. Or maybe they don't even know why they're all over the place and struggling. And our goal with our health and wellness coaching is to help them figure out where the problems are. And then we help them come up with goals. And we help them by giving them resources on campus as well. But we also help them work through a wellness wheel and helping them develop coping mechanisms to get through their day-to-day activities, so they are better off mentally, so they can be academically successful. Next slide. And then a fun plug that the students absolutely enjoy. Students can sign up for a Stay Well subscription bag, and we do a theme every month. Our link is open right now, so if you have your students follow us on social media, they can sign up for a really cool, fun bag. Every month is something different, and it focuses on a specific area of wellness. And they're very popular, so students realize how great they are when they come get them, but we equip them with different tools to help them get through the academic year. So if your student hasn't signed up for a Stay Well bag, they can sign up via our social media outlets through the link. Next slide.
Vadia, can families sign their students up for these bags, or do we prefer students to do that?
Students need to sign up specifically because it'll ask for like personal, like what they like. And so we want to make sure that the student is feeling like they're a little bit empowered in deciding like those selections of the things that they get. Something else that we've been promoting, and we really want parents to help us get the word out. If you have a student who's vaping, we need to help them quit. We have a free quit to text line for vaping. We know that COVID has brought in a lot of things, but vaping has really gone through the roof astronomically. We are seeing so many students who are heavily addicted to nicotine, and we want to help them quit. Not only can they do the text to quit line and get specific, and it's anonymous, we don't know their information, they can also reach out to us to quit using those vaping devices and get free nicotine replacement therapy. Next slide. I mentioned the Student Health Advisory Council. This is just another plug for them. If your student is interested, feel free to have them go to our website and get more information about that. Next slide. We have one more clinic for flu shots. Flu shots are free this year, which I want to plug. We love that we can give students free flu shots. So we have a walk-in clinic this Thursday. Tomorrow, we're there all day in our building on the first floor. Students can just walk in and get a free flu shot. We just need to see their student ID. And if they can't make it to this specific clinic, they can always make an appointment for a flu shot, and it's still free. So make sure you encourage your students to get their flu shot. Next slide.
Vadia, if they can't make it to one of the free clinics, how would students get a flu shot?
So there's lots of options. I would first recommend them to go to the website, go.uky.edu/flu shot. Not only are our clinics listed there, but the UK healthcare pharmacies are also offering lots of options to get flu shots. So go to that website and they can get it that way if they can't make it to UHS. For UHS specifically, they do need to go make an appointment. So they need to either call if they don't have a MyChart, or they need to go online and schedule a visit for a flu shot through their MyChart. Making an appointment. So I've talked a lot about making an appointment, but I'm gonna say it again. You know, we are transitioning, and we know there's been some kinks in our system as we transition to Epic, but hopefully we're working through a lot of different things, and it's going to improve. The easiest way to make an appointment is through online through MyChart. They won't have to, you know, be on hold for a little bit, and they, you know, it's just quicker once they have their MyChart. If they don't have a MyChart, they can still be seen. They just have to call to get their appointment. And the other thing about MyChart that's great is that students, again, they can see their lab results. They can get their class excuse if they need it. So that is another bonus to having the MyChart. The behavioral health line is going to be a different number for them to call to make that appointment as well. Next slide.
Fadia,
Yes, ma'am.
Nancy just reminded me that we get a lot of questions in our UK Wildcat Families Facebook group about urgent care and when to send students to urgent care versus, you know, going to UHS. And can you talk a little bit about urgent care options?
Yeah, so urgent care. So, you know, it just really, quite honestly, after 6 o'clock, the best thing they can do is first, I would recommend calling the on-call physician. If it's after hours and they don't know if they need to go to urgent treatment, that on-call physician number is going to be key because it will be answered by somebody. And then the doctor, because it's always doctors that answer, are going to let you know if you should go ahead and go to urgent treatment, or if you do need to go to the ER. So I'm going to, again, push that on-call physician number to be the first stop after 6 o'clock if we are closed and there are no more appointments. Also, if we don't have appointments for whatever reason, you know, typically what we'll do is we will, you know, try to work you in if we absolutely can. We are still trying to figure out how to do that in this new system. It's harder to do than our previous system, mainly because it's just a lot of layers. So again, first, if it's after hours, if it's after we've closed and you don't get anybody, that's where the on-call physician number is going to be key.
And Fadia, what is that number again? Do you remember it off the top of your head?
No, I don't, but I think it's coming up again. I think I have it coming up with a list of numbers that everyone needs to screenshot.
Perfect.
Awesome. Okay, so vaccinations. We know all about vaccinations. We've all talked about vaccinations. The only requirement right now for the university that is tracked in housing is a meningitis vaccine. So we know that if you live in campus housing, obviously you need that meningitis vaccine. You know, we want everybody to get their COVID-19 vaccine. We want everybody to get their flu vaccine. All these vaccines listed here are strongly recommended. And obviously, you know, the university tracks COVID-19 vaccine. UHS does not track that. So we have gotten lots of questions about that. It goes through Health Corps for tracking for COVID-19 vaccine. We are typically the ones that will track the meningitis vaccine for all students that live in campus-owned housing. Next slide. And this is more information about that student health coverage plan I mentioned briefly about, you know, if you don't know if you have great coverage for your student and you're looking, maybe this is less expensive, but can cover more. Definitely worth looking into. We've had students out of state switch over to this because they do have better coverage. If they say something comes up and they're just needing to come to the doctor more frequently than they were predicting, this again, it could be another option. And you can get that information by calling the student health plan office. That number is listed there, or going to the website. Next slide. So here's that list of important phone numbers. Everybody take a screenshot right now. So appointment line, the PIN, behavioral health, and on-call physician. Yes, ask your student if they have that number in their phone, put all these numbers in your phone, and have them put them in the phone because they'll call you and they'll say, what do I do? So make sure you got it. So there you go. Again, after 6 o'clock, on-call physician. Next slide. So our website has been updated. We've got most everything correct on there after we've switched to our new Epic system. everything I've talked about here is on there. It's another good resource for parents to just kind of look through if they haven't been able to get information about UHS. So really encourage you to go there. Next slide. And the best thing the parents and the students can do is follow us on social media. We post everything that we do every day on social media in terms of like events that we have when we're out on campus doing outreach, or when we have a flu clinic. If we decide to have another flu clinic in November, we'd post that there. So encourage your students to follow us on one of our outlets, and then I would encourage you all to follow us as well. I mean, that concludes the presentation, and then I think I can take questions.
Sure. If anyone out there has any questions for Fadia, I'm sure she'd be happy to answer them. But while we're giving you a few minutes to think of what those questions might be, Fadia, can you talk a little bit about, I feel like we talk to a lot of parents and family members who have students who get sick unexpectedly. And the first thing they do is they call home to mom or dad, and say, I'm sick, I'm not feeling well, I don't know what to do. And families tend to want to take care of them. I mean, as you know, that makes total sense. What advice do you have for families who have children who have the flu or just are not feeling well? As far as how do they support their student during that time?
Yeah, so I think it's challenging in this setting, right? So like, we've had a lot of things come up where parents are a little bit more concerned about their student, especially in a pandemic. Maybe your student didn't get the best ending of their high school year and they're coming to college, and you're concerned about them, being exposed, or you're just in general concerned about them being ill. I will tell you that our staff, most of our providers, have been at UHS forever. They've had kids in college, or they currently have kids in college. So we have a lot of providers who really value students and value what they can do and care. A lot of our nurses have been around for a very long time, and they're amazing. And I'm not just saying that because I work there. We do have great providers and great staff who do genuinely care about your student, and we're going to figure out how to help them. We're going to do the best that we can, and that we just want parents to understand that we get it. We know that you have questions, and that's why parents call and talk to our phone information nurse, and we're fine with that. We totally get it. We do want to protect the students' privacy after the fact they're after 18 years old. We do have an obligation to protect their health information. So we want you all to know that's we're legally bound to doing that. So the best advice I have is to just have a great conversation with your student in terms of developing a relationship where your student can feel comfortable sharing with you whatever's going on with their health, and that they're just willing to be open with you, and that encouraging them to kind of take ownership of their health care, that they can do it, they can make their appointment, they can come in, they can do it. I mean, because I think part of this is teaching them to be young adults that are successful, and we need to kind of sometimes step back and like realize like, okay, they can do this, and it's not that hard. It can be a little intimidating, but encourage them to make the appointments. Encourage them to call. I think that once they get past that first appointment, they're okay, they're fine, they can figure it out. And we find that usually that's the case, that most students, after they might not have seen us at all their freshman year, but by the time they're a sophomore and junior year, they're feeling more comfortable coming in and realizing that we are a legit healthcare clinic, and we have, again, providers that have been there for a very long time, and several who have put their own kids through college. So hopefully that gives you guys a little bit of peace.
I think that's really good to know. I think, so often, whenever, your kids are sick, you want to help them and you want to make them feel better and you want to make it easy for them, recognizing that this is part of, the college process, and giving them the tools they need to make those decisions and make those appointments and go and do those things on their own. It's going to be really valuable. So that's great.
Absolutely.
All right. Well, I think we have answered all the questions, which is great. So we want to thank Fadia so much for being here this evening, and we will be posting this video online. So if you missed something or you're looking for a phone number, we'll have that up either this evening or tomorrow morning for you. If you have additional questions, feel free to keep putting those in the chat and we'll make sure that we get the answers to you. Or you can always email the Parent Family Association at parents@uky.edu and we'd be happy to help. So
Awesome.
thanks everybody. Appreciate you. Have a great evening. Go
Thanks.
Cats.